Hanzumano Sakusa Kaawit.
Ako si Sarah, and this is my story. I have a boyfriend, let's call him Spencer. 2 years na may mag-uyab ni Spencer. And as mag-uyab, dili jud malikayan nga kami mag-away. Usa ka adlaw.
Why are you so pissed off naman ba? Huh?
Pissed off? Kasi nag-ingon na.
Huh? Cause you're acting like it.
Sakit kaayo, Spencer. While naglakaw ta sa park, imong gibuhian akong kamot. Ngano?
Huh? Gibuyan? I didn't mean to do it, okay?
Ambot ni mo, Spencer, uy. I'm tired of understanding you na, Jud. Ambot kung kaya pa ba ni nako, kay murag ako ra manggod ang nag-adjust.
Of course. Ikaw ra jud ang the one.
Wa na ko kasabot, Jud.
So unsay pasabot nimo? Huh? Do you wanna break up? Just like that? Kung mao man gyud mong gusto, then so be it. I'll respect it anyway.
Og nibiya si Spencer. Sarah thought that there is nothing she could do but just cry. On the other hand, si Spencer kaning adto sa bar. Og didto,
Hey Spencer! Hi! Nakusama ka? Did you and Sarah fight again? You know what? It's okay. I'm here for you. If you want, I'll comfort you. Come with me to my room.
og gidala ni Lenny si Spencer sa usa ka kwarto sa bar. And lain di ay na comfort ang iya gipasabot. The following day, Spencer had realized that he and Lenny had done some magic in the night. However, he kept it from Sarah. Ug niuli siya sa balay ang nakigbalik ni Sarah. Nasigot sad si Sarah. And because of that, nag-amor de luna sila. After how many days, naglain ang pamati ni Spencer. Sakit kaayo ang iyang party sa pagkalalaki. Nakita sa niya nga naay discharge. The succeeding days, si Sarah nasad ang nasakitan sa iyang vagina. Because of that, nagpa-check up siya. Sa clinic, iyang gistata na niyang nabati and gi-check up sa doctor ang iyang vagina. And
Okay, ma'am, just lay down there and relax and I'll check. With the examination I did just now, I found out that your cervix is inflamed. So, if I may ask, are you sexually active, miss?
Yes, Doc, but ako ra boyfriend ang akong ka-sex.
Okay, so you're sexually active, so I'll have to order an endocervical swab. And then, for your inflamed cervix, I'll provide you with antibiotics. And then after 1 week, come back here with the results.
after 1 week,
Okay, miss, so based on the laboratory findings, your diagnosis is gonorrhea.
Pero Doc, unsa din ang gonorrhea?
So, gonorrhea is a sexually transmitted infection and is caused by the bacteria called Neisseria gonorrhoeae.
Asa din na siya makita, Doc? Unya, giunsa din na siya pag-transmit?
So, the habitat for the Neisseria gonorrhoeae is the human genital tract and is transmitted to sexual contact for adults, fomites for children, and the birth canal for babies. And for your case, it is transmitted to sexual contact.
Pero Doc, unsa gyud ay ang usual signs and symptoms anang gonorrhea?
The signs and symptoms for gonorrhea in male adults is first, urethritis, which is the inflammation of the urethra, cystitis, which is the inflammation of the bladder, and prostatitis, which is the inflammation of the prostate glands. Next, for female adults, we have cervicitis, which is the inflammation of the cervix, pelvic inflammatory disease or PIC, which is the infection of the reproductive organs, and the PIC may lead to the Kurtz-Hughes-Curtis syndrome. And as for children, we have gonococcal vaginitis in cases of criminal assault, and we have ophthalmia neonatorum, which is the passage in the infected birth canal. As for your case, there is consistency in your inflamed cervix.
Pero Doc, giunsa nimo pagkabalo nga infected ko og gonorrhea?
In order for us to determine if you have gonorrhea, we first have to take a specimen. So for men, the specimen may come from urethral discharge, prostatic smear, skin lesion swabs, conjunctival swab, and joint aspirate. And as for women, it can be found in the endocervical swab, skin lesion swabs, conjunctival swab, and the joint aspirate. After obtaining the specimen, we then take tests. So the test may be oxidase test, which is a presumptive test, the carbohydrate degradation test, which is a confirmatory test, the mini-tech, the Bactec Neisseria differentiation test, the CTA test, and the Fadibact gonococcus test, which confirms the presence of the gonococci.
Doc, naabay treatment for gonorrhea?
Yes, and I will give you a prescription for it. The treatment for gonorrhea may be aqueous procaine, penicillin G with oral probenicid, which is given just before injection, and we also have ampicillin by mouth with probenicid. And if the individual is allergic to penicillin, we may provide tetracycline and spectinomycin.
Ah, okay, Doc. Pero Doc, what to do the eye to prevent from being infected with gonorrhea?
In order to prevent from being infected with gonorrhea, one must remember these following things. First is when you have sexual intercourse, you must use a condom or you must practice safe sex. Next is to limit the amount of sex partners that you have. Third is to check sexually transmitted infections in both you and your partner. Fourth is to have no sexual intercourse with anyone that may seem to have a sexually transmitted illness. And lastly is to consider getting constantly checked for gonorrhea on a regular basis.
Pero Doc, isa raman ako nakasex, Doc. Nya, ako raman sad boyfriend.
Yes, miss. Tinuod nga loyal kasi mong boyfriend. Pero ang pangutana, loyal ba siya nimo?
Oh my God!
Pag uli ni Sarah, iya dayong giatubang iya boyfriend.
Spencer, wa kay puangod. Ikaw pa'y way ayo nga uyab. Imo pa jud ko gitakdan og gonorrhea. Wa kay buot!
Ung mao kadto ang atong storya kanong adlaw. Salamat sa pagpaminaw.